Welcome, everybody. Excited to have you here today to talk a little bit about some success stories we've had in medical billing for clinical services. I've got two of our pharmacists here today, Chris and Ike, that have been working alongside me and AssureCare and AssureRx in really setting up Washington pharmacist providers to provide necessary services. And so we're really excited to have you today. If you have any questions along the way as we go, you can definitely feel free to drop them in the chat and we'll address them towards the end. Today, we'll just have kind of an informal conversation with Chris and Ike and talk about some learnings, some pearls we've had along the way, some wins, some real monies realized for the pharmacies on doing things that they're doing every day, as well as net new services. So we've got, if you go to the next slide, we've got kind of three panelists here. Myself, who I'm a pharmacist with AssureCare, and I have had a long history kind of working in the space of pharmacist prescribing and really had a big vision for proving out that pharmacists can be successful, really supporting the entire pharmacist provider journey, starting with launching clinical programs and identifying community needs, really all the way through to getting paid for those claims and really starting to show that quality to local providers and payers and community members. So I've been lucky enough and fortunate enough to work alongside Chris and Ike kind of on those journeys that we've started together. Chris is owner of Schaffner Pharmacy and Apothecary Coffee, and he's a nationally recognized leader in independent pharmacy. And he spent a lot of his career in the space of community pharmacy. He has worked, he graduated from the University of Washington and has really dedicated most of his career to providing those clinical programs and really proving out that reimbursement model. And he's currently in network with a lot of different medical payers. He's starting an innovative residency program this year in a community program and has a lot of really high quality relationships in his community that we found to be really beneficial for us. And Ike is a newer owner. He's the owner of SquareCare Medical and Pharmacy. And he had this really neat dream to be able to provide a health and wellness center that's locally owned and operated and really serving the needs of the local community and friends and family. And I kind of found his story pretty interesting. He's board certified, worked at a health system for a lot of years, tons of experience in critical and emergency medicine and kind of your non-traditional pharmacy owner background. But he spent a lot of time doing various volunteer roles and really starting to identify that need in the community to be able to provide clinical programs. And during the height of the COVID pandemic, really stepped up to provide necessary vaccines to homebound patients and is really passionate about everybody being able to be as healthy as possible, have that access to care, and make sure nobody is left behind. So we're really excited to kind of pick their brains and just learn a little bit more about what they've done and kind of what those experiences have looked like so far. So what we have kind of come together to do at AssureCare, just a kind of level set of what Chris and Ike have kind of set up in their pharmacies, and then we'll kind of turn it to them to talk today about their experiences, is really looking at an entire clinical picture and saying, you know, can you launch clinical programs and really make them be a successful business model for pharmacy? And what does that look like in addition to your kind of keeping the lights on with your selling of your medications? And we've really found that the answer is truly yes. And that's kind of my vision. It's, you know, proving out to Chris and Ike and probably many of you here today that this is a profitable business model to be able to provide those necessary services in our community, be that standard of care. We know there's a shortage of healthcare providers and physicians, and we know it's just getting worse. And so how do we know that this is a viable service that, you know, warrants that time and investment? And can we even staff to support these types of programs, or do we have to kind of try to squeeze them in our spare time? So those are some of the things we'll talk about today. We really when we look at clinical programs, we're not just looking at medical billing. Medical billing, of course, being set up as a credentialed and enrolled provider, part of that provider directory, is huge, and it makes a big difference to be able to receive those medical claims. But we've also realized it's really important to look at the holistic picture. There are a lot of cash-based services that both Ike and Chris are providing to their patients. Medication therapy management services that might be in external vendors or other various paid opportunities, or even medically billed MTM opportunities too. Grant funds, various value-based care contracting opportunities, working with employer groups and clinics. I know Ike's gone into a lot of companies and done a lot of vaccine clinics, and so has Chris, as well as starting to say, okay, if I'm providing these robust encounters and making strong recommendations, what else how do I bring traffic in my pharmacy? How do I increase my overarching PBM sales as well? So we're kind of looking at all of those things as we look at their journey. Today, when we start to talk about reimbursement, we really have just up to today looked at medical claims reimbursement, but going forward, we're kind of looking at the holistic picture as we head into 2023.